Hi, I'm Dr. Ryan Berns, primary care sports medicine here at Bell & Health. Grew up in Oak Creek, Wisconsin, then did a lot of my schooling here in state. I was at UW-Madison for an undergrad and a master's degree in public health. Then after that, I was here in Green Bay, did my medical school training here at the Medical College of Wisconsin in Green Bay. I was part of that inaugural class at MCW Green Bay, so that was pretty cool. Then after that, did my residency and fellowship both down in South Bend, Indiana, Memorial Hospital there for family medicine training, and the South Bend Notre Dame Sports Medicine Fellowship. So it's been a great experience, but glad to be back here in the Green Bay area. All physicians obviously have a lot to bring to the table, but I think the family medicine doctor really knows that patient and can understand some of the nuances. A lot of times when patients get bombarded with a lot of clinical information, maybe seeing some specialists, they come back to their family physician who's kind of their home base. So I always liked seeing that, and being that kind of calming, logical presence for the patient. If patients are able to get all the information, understand and make a good educated decision, I think a lot of them will make really great decisions. Obviously I'm there to help guide them, but at the end of the day, I think patients do have a lot of autonomy, especially in this health system. I've seen, lots of great patient autonomy. If we have 3 different options here, 1 or 2 are probably the best options, but we could always wait and see a little bit too, which would be okay for a short period of time. So, I think if patients are involved and more comfortable with their decisions, that gives me a good sense of we did some good work today. I've always just had this passion for athletes, active populations. I was a former athlete myself, so want to keep people active, healthy. Almost always you can find something that someone does that I would consider an activity. Gardening, walking, sure, if you're jogging or more active, with a weightlifting program or something, that's great. But for me, it would probably be hard to find someone that doesn't have something that I would consider an activity. So it's finding out what they like to do. How can we maybe build in a little bit more of that, or even kind of a tangential type activity that they love and enjoy, and can continue to kind of build their activity like that. People get lumps, bumps, injuries. We want to keep you guys healthy in the game, feeling good. Want to obviously keep you doing what you love.